think Secure is coming at the opportune time when I know very well that most training institutions have been conducting a lot of research, and I've also been both local and internationally, and also we know they have released very many students. Health workforce has been significantly improved. And as a secure program, from what I've seen and heard, I think it's going to address a very major gap in now building capacities at two levels. One, translating all that research into policy practice to advise at that level, and obviously improve health outcomes. And also, to some extent, supporting the training of this mindset so that everyone can be involved in the use of data for best practices. That one thing very strongly, because for anything to be sustainable or to meet the health agenda as required in terms of improving the quality of life, is really to make it, to help the policymakers take it as part of their business, to also look at research and the evidence there too, to improve the other outcomes. Let me also add that if the policymakers appreciate that, we can also take it a notch higher, because research per se, it's literally everything that which any country requires, even in terms of issues to do with the politics, even in terms of economy. So currently there is obviously a lot of talk about knowledge economy. That is really about research. And unless and until the policymakers are made part of this whole, I would call it a movement, of seeing our country and our continent is part of the global economies, I think we may not succeed unless those policymakers really are. And based on your strategy, which I really admire most, you are really there in terms of the involvement of the parliamentarians, key policy makers, like the way you are using the ministry. So that focus is key. And I think if you manage that, I can't recall or remember any institution which has really have this kind of an approach, which to me I think is the most important, because everything is about the leadership.
Yeah.
And so if you can manage that, the idea you're involving the speaker is a champion, then the health committee, and then obviously key champions from key institutions which produce the necessary capacities for research, like the universities, research institutes. I think this strategy is excellent, and maintain that.